That is a staggering statistic 6 months after the first case was discovered in Wuhan, China. That 6 months later, the number of cases continues to rise. The message is the pandemic is not over. It is raging all around us. To date, 429,067 persons have died. We are closing in on 500,000 good souls who have lost their lives due to COVID. These statistics should be sobering to all of us in Trinidad and Tobago, because I think because of our successes, we are starting to become a bit complacent. We are starting to lose sight of the fact that even though we have done well in Trinidad and very well, we are still in the midst of a global pandemic. Territories and countries near to us and dear to us, both to the north, South America that are close to us, their caseload continues to rise at alarming rates. What are our local figures to date? The number of tests conducted, 3,846. Number of unique patients, 3,336. Number of repeat tests, 510. The number of positive cases, thankfully, remains constant at 117. We have contributed 8 deaths only to that 429,000 deaths, and we would like to keep it like that with even more vigilance as we move forward. Number of persons discharged to date, 109. What is the status of our community testing that gives us some idea of what is circulating in the community as we do our stratified random sampling testing in the counties in Trinidad and in Tobago? We have done to date 1,558, which is a pretty good number. And thankfully and luckily, to date, all 1,558 community tests have been negative. So these are the numbers and figures. The message I would like to leave the population with as I hand over to Minister Cox is that globally, COVID-19 continues to wreak havoc with economies, with businesses, airline industry. Many airlines have had to shut down, lay off workers. The tourism industry has had to shut down, lay off workers. Hospitality has had to lay off workers. We in Trinidad and Tobago, we have suffered some of that. And in the midst of all of this, the Ministry of Health has even found time with their COVID response to hire an extra 526 persons, mainly doctors and nurses, who would not have been with a job. So in this period of COVID, we have actually increased our employee level by 526 persons. And that is a very good place to be when you recognize that so many people, unfortunately, like the single mother casino worker, doesn't have a job and now has to depend on state benefits to get through. So the message I want to leave with, let's be all thankful for our individual circumstance. We have weathered a very big storm so far, but as we allow people to come back into the country in a very structured way via the Ministry of National Security, and Dr. Richards will speak to that now, we have to be ever mindful that our parallel healthcare system as set up is basically filled at this point in time, and it will be filled for approximately the next 2 weeks because we have over 200 persons coming in from Jamaica, Barbados, other groups. We have quarantined 306 people, I believe. Dr. Richards will give you the exact number. on a cruise ship, and she will explain to you the massive undertaking that happened yesterday. So our parallel healthcare system, in talking with the Minister of National Security yesterday, is basically at capacity at this time and will be so for the next 2 weeks. We would not be able to accommodate big groups, and let us hope that no one presents with positive tests, because if we get many positive tests, it means that a facility cannot be turned around in 2 weeks. It will take longer, whichever facility it is that unfortunately a positive test should turn up in. That facility, by protocol, will have to undergo its own quarantine, its own out period for a period of about 2 weeks. So that is where we are so far. So Minister Cox, I want to thank you for this opportunity, and I turn back to you.
Thank you very much, Minister. Dr. Mariam Richards, the Principal Medical Officer, Institutions at the Ministry of Health, will now update us on parallel health facilities. Dr. Richards.
Good morning to members of the media and to the listening population of Trinidad and Tobago. This morning I would like to focus on the operations of the parallel healthcare system of the Ministry of Health. The parallel healthcare system was operationalized on March 12, 2020, with the opening of the Couva Medical and Multi-Training Facility, or as known, the Couva Hospital. Since then, the Ministry of Health has been able to operationalize and to have approximately 918 beds allocated to the COVID-19 response. The parallel healthcare system is the Ministry of Health's response to the COVID-19 pandemic. I'd like to explain what is meant by a parallel healthcare system, because it's a term that you would have heard significantly in the media. Firstly, the parallel healthcare system really represents an alternative medical pathway for specialized care for persons with COVID-19. The benefits of such a system include the ability to have a specialized level of care and treatment for persons with this illness. COVID-19 is highly contagious and highly infective. Accordingly, through this system, we are able to isolate persons and to offer them the best treatment possible. The medical management of COVID-19 really revolves around the primary care physicians, public health specialists, intensive care specialists, and internists and anesthetists. So with this system, we are able to really allocate and our resources in terms of human resources, personal protective equipment, in such a way that there is a minimum amount of wastage and specialized care. Another major benefit of the parallel healthcare system is that the traditional healthcare system, which the rest of the population needs to access, for example, for diabetes, hypertension, and strokes, continues to operate uninterrupted. At this point in time, we have been able to resume our elective surgeries in hospitals up to about 80% of the normal pre-pandemic levels, and this is expected to resume to normal rates within the next 2 weeks. In this way, we ensure that members of the population no longer or will not be disadvantaged by the presence of another pandemic and another illness. So there are several benefits to the parallel healthcare system. As of this morning, we have treated or managed 957 persons under this system. And I'd like to reiterate that the parallel healthcare system does not just merely refer to facilities, but all facets of treatment, meaning clinical care, testing, counseling, and otherwise. So the parallel healthcare system consists of about 13 state-run facilities spread across 4 levels of care, for the population of Trinidad and Tobago. And the division of beds and spaces is really based on international standards, with about 5 to 7% allocated for ICU care, about 15 to 20% of care for ambulatory or hospital care, which would be for moderately ill patients, and the remaining for quarantine facilities. This morning, I'd like to highlight on the quarantine facilities, because I'm well aware that many members of the population are concerned about their relatives and family loved ones returning home from abroad. As of this morning, we have managed 616 returning nationals under the parallel healthcare system at quarantine centers. That's a significant figure, considering that yesterday alone, in the afternoon, within 12 hours, we managed and facilitated 336 persons. I would like to stress that it is an extremely well-organized approach and methodology that we use in managing the quarantine centers. It has been a learning experience, one that we have improved since the beginning, since our first case of COVID-19, and we continue to learn and to evolve with the feedback that we receive from members of the population and from our patients and healthcare workers. Yesterday, we had an extensive exercise which involved the repatriation of 306 nationals who were on board the Royal Caribbean vessel Enchantment of the Seas. It is the largest operation on intake of returning nationals that we have done since the COVID-19 pandemic started with the Ministry of Health. So just to give you an idea of how the quarantine centers run and the process for the returning nationals operates. The Ministry of National Security, through the Honorable Minister of National Security, is responsible for granting the exemption for a returning national or groups of returning nationals to return to Trinidad and Tobago. Once this exemption is granted, the Ministry of Health, through its policy, has to offer state quarantine or state supervised quarantine to the returning national. During this process, the returning national will have to undergo a medical assessment, which will include nasopharyngeal swabs and testing done through what is called reverse transcriptase polymerase chain reaction testing. This is the gold standard for COVID testing and is currently recognized by the World Health Organization as the best method. We are really concerned about bringing your relatives home and ensuring their safety, not just of them, but of you. And our quarantine centers have been modeled to bring them one step closer to home and assist them, because we recognize that they would have been faced with a very stressful situation. So the first process involves the approval of the exemption from the Ministry of National Security. Subsequent to that, we receive communication and we conduct a risk assessment of the person based on their history. So for example, if the individual is coming from an area that has a high rate of COVID-19, or they have been in contact with persons with COVID-19, we would select a certain level of quarantine centers where they would be totally isolated in that they have their own ensuite bathroom, their own bedroom, etc. If they are coming in groups, for example, persons who may have been in the same university dormitory and so on, they may be placed in a floor or an arrangement where they may share bathrooms, let's say 3 to 4 persons to one, like in a dorm sort of arrangement. When the risk assessment is conducted, we then have to arrange the logistics of flying that person in. And that operation really involves the Trinidad and Tobago Defense Force, the Global Medical Response Team of Trinidad and Tobago, which is the ambulance service, as well as the Civil Aviation Authority, the Airports Authority of Trinidad and Tobago, and the Ministry of Health. It's an operation that we need to really have well coordinated, and we've successfully done several transfers. For example, on Thursday, which was a public holiday, we did 9 transfers in a space of 12 hours. We make arrangements for the incoming persons to be met on the tarmac and to be taken off the tarmac by a Trinidad and Tobago Defense Force vehicle and a Trinidad and Tobago Police Service escort. The Customs and Immigration team processes the application, so they do not need to be exposed and to walk through the usual departure hall, and they are taken directly to the quarantine center, where arrangements are made prior to their arrival so that they can go into their rooms immediately. Then once they are in their rooms and they receive their meals, we do a process where we would bring them down in groups of 2 to be medically assessed by a physician and have their swab taken. Now, understandably, in extenuating circumstances, for example, last night when a flight arrived at 11 p.m. with 29 returning nationals from Venezuela, we would not subject persons to a medical assessment at 1 a.m. upon their arrival at a quarantine center. However, we ensure that within 12 hours of their arrival, they are assessed by a medical practitioner and have their nasopharyngeal swabs taken and sent to our laboratory services. After the persons are dropped off at the quarantine center, the Trinidad and Tobago Defense Force now has to decontaminate that vehicle, because we do not want to have our Trinidad and Tobago Defence Force soldiers who are driving those vehicles and in contact at risk of COVID-19 infection. So that's another step that has to be taken. Yesterday's operation involved 111 persons from a variety of groups: the Ministry of National Security, Trinidad and Tobago Defence Force, Customs and Immigrations, the Port Authority of Trinidad and Tobago, physicians, nurses, clerical officers, and even labourers from the 4 regional health authorities. Just to summarize the efficiency of the operation, the Enchantment of the Sea arrived on or about and was docked at about 3:45 or so. Customs and Immigration and Port Health did their necessary clearances, and we were able to start calling patients from the vessel at about 4:25 p.m. in groups of 5, and then we increased to groups of 10 because of the speed that we were seeing them and the efficiency of the process. Within 2 hours and 45 minutes, we were able to medically assess and to sample all 306 persons and have them return to the Enchantment of the Seas. We had no adverse incidents. Persons were not left waiting very long, and they were generally very happy. In fact, we had no complaints at all yesterday. This demonstrates the level of organization that the Ministry of Health has worked on improving since this pandemic started. Additionally, in terms of the selection of our quarantine sites, it is done by a multidisciplinary team of technical experts and professionals, and we consider several factors in selecting the actual site. We look at the public health implications with public health specialists, primary care physicians, and a public health inspector or inspectors depending on the size of the facility. We also look at the engineering aspects of the facility, and we look at the importance of preventive maintenance and the operations of the facility, because we recognize that if your air condition system, for example, is not appropriate, it increases the rate of spread and infectivity. We look at the water supply, we look at the general spacing and bathroom allowances of the facility as well. We also emphasize on the importance of infection control and prevention, and we have a national infection control and prevention team of specialist physicians and nurses that accompany us on our site visits. There is also the input of Ms. Patty Ann Williams, our hardworking disaster technical coordinator for disaster preparedness, who actually oversees the selection of facilities in my absence when I can't be present. And she really looks at all the disaster preparedness components, as well as, and is supported by the Occupational Safety and Health and HSE personnel. So it's quite a large team, and we even consider, the legal aspects. We consider the community, the social and environmental impact of placing persons for quarantine, and we try to communicate with the community and let them know, if it's in a very densely populated area, what is going on, to mitigate risk and to reduce the risk where people are not properly informed. So by and large, the selection of the quarantine centers is very specific, and we have authorization from the Honorable Minister, the Permanent Secretary, and the Chief Medical Officer before we place persons into those centers. In closing, I would like to reiterate that this is a unique situation that we are faced with as a population. It has been a learning experience for us, and we have modeled our efforts based on international evidence. For example, the quarantine centers and our what we call alternative medical care sites are guided by international best practice that we receive technical support from the WHO and PAHO on. And we also are guided by international engineering codes for these facilities to ensure that our patients are safe and comfortable. So while we agree and we understand that our patients and our returning nationals are anxious to come home, we want to ensure that when you come, you have an excellent experience where you receive a high quality of care and you are safe. And so we engage multiple stakeholders and partners to ensure that your experience is essential and is excellent. We also, at the quarantine centers, ensure that persons have communication links with the persons who run the quarantine centers via WhatsApp. We have quality assurance and quality control mechanisms, as well as services for mental health counseling, because we recognize that persons are under undue stress. We really appreciate and we work on the feedback received by members of our population on the quarantine centers, and we try to act and really improve upon the situation. While we may not be able to satisfy every single request, every request is considered, and we try to communicate with persons at the quarantine centers or a leader possibly on a daily basis to understand if there are any issues possible. So in closing, we would like to thank the population for your patience in allowing us to complete this exercise, and we would really like to underscore the point that we are concerned about your safety as a population as we bring your relatives one step closer to home. Thank you.
Thank you very much, Dr. Miriam Richards, for your comprehensive and informative information that you shared with us. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. So let us keep this in mind as we begin taking your questions. 98.1.
Good morning to the panel. Stephen Cummings.
Morning, Mr. Cummings.
Good morning.
Morning.
My 2 questions go to Minister Dayal Singh. And the first one, Minister, in the last few weeks, the Ministry of Health through CARFA has been involved in the process of evaluating private lab COVID testing quality assurance via the PT panel system. Can you say as to where we are regarding those results? And the next question, in our continuous scaling up of COVID patient accommodation, is the spanking new AREMA hospital being looked at this time as another possible facility, that can work in tandem with the healthcare, the parallel healthcare system? Should there, should the need arise for, let's say, added capacity?
Yes. Thank you, Mr. Cummins. And those are very relevant questions. So let's talk about testing and ramp up of testing in both the public and private sector. When we started testing way back in February 7th, we started our first COVID test on February 7th. This was just about a month after the issue of COVID became a reality. CARFA was the only lab in the CARICOM region certified to do PCR testing, which is 99.6% accurate. From that, we have evolved into having the facility at Eric Williams, on the site of Eric Williams, the UE Virology Lab, take up some slack. So that's 2 centers. Tobago received their machine. Tobago is now in the process of clearing their testing kits. Once that is done, that is going to be a 3rd site in the public sector. San Fernando already had a brand new PCR machine from Abbott, but because of the trade embargo which the United States put on everything leaving the United States COVID related, we could not access the test kits. I am now happy to report that as of yesterday, the test kits have in fact come in, and now we have to do our certification for Southwest. So very soon, you are going to have a situation where we move from 1 to 4 in the public sector. In the private sector, the CMO has told me that 1 lab so far, only 1, has received the green light, but then he also told me yesterday he got some false negative reports coming out of that lab. And that was our concern from day 1 with private labs. So we are moving very cautiously in both the private sector and the public sector. And may I say, every public sector lab that we push through the quality assurance process, whether it's Tobago, whether it's the UE lab in Eric Williams to take care of that, whether it's San Fernando, goes through the same quality assurance process as any private lab, because this is a reportable disease and we have to report our figures to WHO. So that's where we stand. On the issue of AREMA, initially we were going to reserve AREMA for COVID. We are reviewing that right now as we stand, because CUVA now has not had a patient for over a month, since May 19th. CORA does not have a patient. So we are doing a wait and see, because we have to work on the assumption that these 306 cruise ship people have the potential to be positive. We have to work on the assumption that the 200 students coming in from Jamaica and Barbados have the potential to be positive. If a significant portion happens to be positive, then we have to have facilities. Let me take you back to the first cruise ship cohort of, I think, 68 that came in. 52 turned positive on us. So it's a bit of a wait and see game, but we will make a final determination on AREMA. But AREMA can be operationalized very soon for community use, but we will make a decision in the next couple of weeks. Thank you very much.
Minister, I'm happy you touched on that, because there's a question online. If most of those cruise ship persons test positive, God forbid, then what is the plan? So
then what is the plan is that we have 100 places for secondary and tertiary care at CORA, and another 200 and something plus. But many cases that turn positive may not need a hospital environment, right? Yes. So that is why we have to be so careful in not making firm commitments. We have to wait and see this massive amount of people that have come in over the past 24 hours, 306 in one cruise ship, and then we have over 200 coming in from between Jamaica and Barbados, is going to put a tremendous strain on the system. And that's why at the start I said we are basically at capacity right now. Thank you.
Okay, thank you. AZP News.
Hi, good morning. Priya Bihari, azpnews.com.
Morning, Priya.
Hi, morning, Minister. The SEA students who go back to school on the 20th, they are 11, 12, are they expected to social distance, and are they expected to wear a mask from 8:30 a.m. to 3 p.m.? A lot of parents and teachers are concerned about that.
Okay.
I want some directions along those lines.
So they don't go back to school on 20th. I think the exam is carded for August.
July,
20th.
no,
wbut the fact is,
they go back from the 20th.
July 20th.
Sorry, 20th of July.
Yes.
Okay,
the
sorry.
exam is in
Yeah.
August.
So the chief medical officer has been having very detailed discussions with the Ministry of Education, and they have developed their policies and protocols, which the Ministry of Education has, but I would not like to speak on it out of turn. I would prefer the Ministry of Education speaks on it. But we have assisted them and guided them and have given them written protocols.
Thank you. TV6.
Hi, good morning, everyone.
Good morning.
Simple question. At what stage, seeing that quarantine is such an expensive thing upon the citizens of the country, at what stage are we going to decide where we can have persons quarantined at home? Are we going to look at each case individually, and is it something possible coming in the future as time goes by? We can have persons quarantined at home, easing up the healthcare system.
Okay. The issue of quarantining at home is a very controversial one. The question is, how do you guarantee that persons will stay home? So it is not something that we are actively encouraging at this point in time. That is why we are bringing in people in a very strategic manner, working with the Minister of National Security so we could put them under state quarantine. And that is done to protect the population and even to protect those people. Because if those people turn positive and they're at home, then they infect their families. And then we start a whole spiral of cases again. So we are not considering home quarantine at this point in time because of the obvious dangers that it poses. Thank you.
Thank you. Yolan Thomas. TTT.
Hello? Hi.
Hello, yes, we are hearing.
Yes, given the fact that you stated that the system is already under strain, given that there are 500 plus persons, being hospitalized, not hospitalized, but being quarantined.
Quarantine, yes.
Yes. Can you say for the 850 persons that was given by the National Security Ministry, would there be a stalling of these persons coming in the system?
So we work with the Ministry of National Security. They ask us what is our capacity. We tell them what is our capacity, and then we work together to bring in people in either individually or in groups. At this point in time, I had this conversation with the Minister of National Security yesterday. Because we have accepted these over 200 UWI students, the people coming in from Caracas, we have some people coming in from Mexico, we have to accommodate the 306 persons, even though they're on a cruise ship, it still takes human capacity from our end. Right now, for the next 2 weeks, the Minister of National Security will work with us to see after this 2-week period what can be allowed to happen afterwards. We just don't make the decision on the day for tomorrow. It's a process, and the process can start as soon as Monday as to the next wave or the next group of persons we could allow to come in, depending on the kind of results we get now. Okay? Thank you.
Thank you. We move now to TTT.
Hi, good morning.
Morning.
Given that the CPL wants to host here, and given that the fact that the quarantine facilities, the capacity is being used up, will that be a major factor in the decision to have the CPL here, or will spaces be made available?
Okay. So, that's a nice question, Ian. You may remember that I said, as an avid sports person, follower of cricket and so on, we'll be looking closely at the West Indies tour to England to see, right, I see Ian nodding his head. So let me tell you how I have been paying attention. What did they do that we could look at as a model? When the West Indies team arrived in Manchester, they were taken directly from the plane to the tarmac to a bus. They did not have to pass through a terminal. Then they were taken straight to a hotel. They did not interact with the public. And then they will be allowed to quarantine and train for 14 days before they play their first test match, I think, on July the 8th. So what you are seeing there, Ian, is a process of no mixing. They have built a sort of a bubble for the West Indies team to arrive. They were transported by private charter, land in Manchester, put on the tarmac, put on a plane, sent straight to a hotel, and then they are quarantined. So it's a model that the CPL will have to look at, and we at the Ministry of Health can provide any technical advice that they would need. But I am paying very close attention to what is going on in that tour. Thank you.
Thank you. We move to Newsday.
Good morning, Janelle D'Souza from Newsday. A question for Dr. Abdul Richards. How are those in quarantine aboard the cruise ship being monitored? doctors going aboard? Are they coming out and so forth? And has it been confirmed, Minister, has it been confirmed that the one person returning from Venezuela is COVID positive, and where have they all been taken?
Okay, so let's go back to the issue of patient confidentiality. You would have seen, I believe, in the Newsday front page article, I believe this week, Janelle, could have been your newspaper, talking about a man saying no stigmatization. You remember that? And I have been personally pilloried for defending the rights of patients not to have their medical status disclosed, from prince to pauper. Every time someone from the media talks about a person of a specific gender, an individual of a specific age, I have resisted stoutly the temptation to disclose any identifier that speaks to a particular patient. Speaking about 40 persons turning positive from a cruise ship contingent of 68 is totally different to singling out a patient. I will continue to defend patients' right to confidentiality, as inconvenient it may be to certain persons, and I will continue to take the blows for it. But it is my sense of personal ethics as a Minister of Health that individual patients should not have their medical status discussed in public. Thank you.
Thank you, Dr. Richards. Do you want to add anything?
Yes, I'd like to speak about the quality assurance and quality control processes on board the Enchantment of the Sea, which is on the Royal Caribbean Fleet. When we received the request to quarantine 306 nationals at one point in time, the Ministry of National Security and the Ministry of Health engaged in conversation and several discussions with the Royal Caribbean heads to really try to have the safest possible solution, and that was most comfortable for the Royal Caribbean crew members, as well as support and that would support and not overwhelm our parallel healthcare system. Royal Caribbean agreed to basically park or to have a docked anchored a large vessel, the Enchantment of the Seas, for Trinidad and Tobago nationals. And we have had discussions with them, with our infectious diseases specialist, as well as the leader of our national COVID-19 clinical team, Dr. Michelle Trotman, and our public health specialist, to ensure that the mechanisms on board the boat for sanitization, for quarantine of the returning nationals, is in line with the WHO standards. We had a discussion with them as recently as Thursday night, where they were able to provide us with all of their protocols for sanitization. And we had our infection control team, our national infection control team, really review those protocols, and we were satisfied with the levels there. We are in contact with the ship's medical team, which consists of 2 physicians and 3 or 4 nurses daily. They submit vital signs to us on a regular basis, and we have a process for transferring any patient who becomes unwell on the vessel. We can board the vessel, but we are concerned about the safety of our returning nationals on board the vessel in terms of introducing persons there, as well as the safety of our healthcare workers. You would recognize that the parallel healthcare system has employed several physicians. And yes, we have been speaking about the efficiency in terms of managing those persons, returning nationals and others, but we also place a lot of emphasis on the care for our healthcare workers, because we cannot afford to have our healthcare workers become infected from contact or exposure. This afternoon, we actually have the arrival of 142 University of the West Indies students from the Mona campus, and we have several processes in place to ensure that they are safe and they minimize their mingling until they get to their on-site campus. And just to let you know the magnitude of the exercise we've been carrying out, we have 370 incoming nationals between today and the 17th of June. So our quarantine facilities are really filled. They are not overfilled where persons are uncomfortable, but we really cannot accommodate large groups of persons at this point in time. We have persons from 2 cruise ships who have smaller groups who received their exemptions and would be coming in on the 15th of June as well. So I hope that answers your question.
What I could add to that answer, because we are quarantining on a cruise ship for the first time and we don't have that experience, I did ask Dr. Richards to give me a schematic of the cruise ship, which he brought to me yesterday, and to ensure that persons are spaced out. So on my desk, I have a schematic of the different floors, different levels of the cruise ship, to ensure maximum spacing out of persons. So we are not having persons in consecutive rooms. We have spaced them out on floors and on levels. Their meals are brought to them, and then they are quarantined in their room. They can exercise on their balconies and so on. But because we are quarantining on a cruise ship for the first time, we are being very, very careful. And at any one point in time, we know at the ministry, because I have the schematic, who is in which room, on which deck, on which floor. So that way we can manage it properly.
Thank you. CNC3.
Good morning, everyone.
Good morning.
Morning.
Minister, this is for you, and pardon my digression, but in our post-media review follow-ups, I just wanted to ask this question. One opposition MP, she basically questioned the millions now being allocated to the TRHs, of which some will be used to hire staff. According to her, a recent audit suggested that there were some ghost workers at the TRHA, at least 9%, right? What's your response to that and her calls for transparency?
So that question is best posed to my colleague at the TRHA, Secretary of Health, Wellness and Family Services, Tracy Davison Celestin. So that is where I think you should direct your concern and or question.
91.9.
Hi, good morning.
Good morning.
Ministers, good morning.
Morning.
This is Richards, VNXW 91.9 FM. I just had a question. We had on our afternoon drive program the head of the Registered Nurses Association, and he did make mention that a number of nurses may have contracted because of the use of the PPE. They may have been, subject to getting some UTIs and other concerns that they have raised about their health going into being COVID responders. I just wanted to know what step might happen and so on, but what else was the ministry doing to support the nurses as they've been, clamoring for some extra support?
Okay.
And if you have any information as well, sorry, second question. If you have any information as well, if you could tell us what the facilities will be like for bars, if there's any information.
For what? Sorry? Bars?
So what's going to happen with bar parameters have you recommended for bars that are looking at less people? They are looking at people staying a particular amount of time. Could you give us any insight on that?
Could you hold, please? We'll answer the first question. We're not hearing you clearly until this is fixed.
Okay.
Then we'll get back to you to pose your second question.
So anybody, healthcare worker, member of the public who has a UTI can seek medical attention. We are treating our healthcare workers in a very special way, and they will not be denied medical attention for a UTI or anything else, Vern. That's what I can say.
Okay, could you now pose your second question? We were not hearing you clearly.
Right, I seem to be having some connectivity.
Yeah. What was the second question, Vern? The second question.
Yes, we're hearing you.
Right. The second question is, looking at the bars, what are the parameters being put in place in the bars? Are there some restrictions or
Sure.
what are we looking at?
Okay. So bars, Vern, this is one of the reasons why we are looking at bars to open back last, because it is virtually, given the nature of the social interaction that happens in a bar, people are happy, people want to socialize, people want to consume their favorite beverages. The wearing of masks is going to be a difficult issue. The issue of social distancing is going to be difficult. In a bar, when you're playing music and you're having a good time, your inhibitions start to drop. You tend to speak louder, you tend to congregate, hug, kiss. It's a very social atmosphere. And that is why we have left bars for last, because we want to make sure the environment is as theoretically free from COVID as possible. Because we know when bars are opened, even though we have received their recommendations for protocols, we know in a bar setting, it is not going to be adhered to. So we are prepared for that, and that is one of the reasons we took bars to open back last, given the nature of the environment. When people are happy, the inhibitions have dropped, and they will take more risks.
Okay, folks, we go back to 98.1 and one question, please.
Thank you again, Minister Cox. Stephen Cummings here again, 98.1 FM. Dr. Richards, you spoke about this unique experience that you've had, with the positioning of your staff and the whole healthcare system in treating with COVID-19. Would you, if you have the opportunity to do this again, all over again, would you do anything different from what you have? Or or are we looking at a template for which we can move forward in the possibility of, further such cases? Thank you.
Thank you, Mr. Cummins. I think that's an excellent question that you've posed to us. And I'd like to reiterate that all along we have recognized that this is a learning process and an iterative process. It's been a process that has been guided by science and public health. We have had advice from parties such as the World Health Organization, the Pan American Health Organization, even development banks like the Inter-American Development Bank and CAF, the Latin American Development Bank, from the Caribbean Public Health Agency. And we've even learned from countries who have managed this epidemic well via teachings that they would have exposed the Ministry of Health. In terms of how we have been moving forward, we have actively engaged in receiving feedback and responding from persons and their relatives and healthcare workers who have been quarantined. For example, we've heard from relatives that the guide in terms of what can be done in and out of quarantine is really unclear. And we've really worked at our quarantine centers to have, in the past 2 months, a clear guide, what is allowed and what is not. We have heard complaints from persons within quarantine centers about their meals, and we rapidly adjust that. We recognize that persons can't have home meals at times, and we try to set our menus that replicate something that they can have at home, but that still be healthy. Because remember, the Ministry of Health is not just about COVID, but about protecting the population's health from one of our biggest scourges, which is the non-communicable disease epidemic. In terms of communication, we have improved our communication mechanisms since this pandemic began, and we have hotlines for patients and persons and their relatives to call into for mental health, for complaints. We have an incident command structure management system, so persons in quarantine and relatives can directly contact the physician or the county medical officer responsible for that quarantine center if there is a challenge. We have a patient care system and a care package system that we adapt regarding the patient's needs. And so it's a very adaptable system when it comes to ensuring the safety of the patient and the comfort of the patient. We are looking at this as an evolving model for our healthcare workers and patients to protect the patient's safety and that of the population. In terms of where we can improve, life is about continuous improvement, and we at the Ministry of Health believe in this very iterative, feedback-oriented, results-style sort of process and management. And we've been trying to improve our communication mechanisms to allay the concerns and what may be perceived as discomforts from members of the population regarding the quarantine process and the exemption process.
Thank you very much. We go back to ACP News. One question, please.
Hi, morning again, Priya Bihari.
Morning, Priya.
Good morning.
Dr. Richards, when you initially spoke, you said that yesterday you all dealt with 336 people, 306 from enchantment of the seas and 29 I'm from Venezuela. That is 335. Can you tell me who is that other patient and where was that person sent, or and where did he or she come from?
So we allow persons in in groups or individuals, right? So 306 persons was the cohort from the Enchantment of the Seas. We had another 29 persons that came in from the Venezuela cohort that came in close to midnight last night. We also allow individuals, for example, employees of the oil and gas sector or maritime students or any other persons who may be on vessels that are nearby Trinidad and Tobago or in terms of docking nearby. We understand the concerns that these persons have been away from their family and may have completed their work duties, and these persons, and if the vessel is docking nearby and we have space to permit them, we try to accept the individuals. So there was an additional person, an individual that came on and who has gone into a state supervised quarantine facility.
Okay, thank you. 91.9. One question, please.
Sure. Hi. Good. Hi again.
Hi.
Just quickly, Minister Alleyne or Dr. Richards, if you all could just speak to the issue of stigma and discrimination, especially with respect to recovered patients, persons returning to their communities, just to give the public some reassurance that, once these people have tested negative, they're safe and they're in the community. If you could do that, I'll be appreciated.
Vern, I really want to congratulate you on raising that issue, because post that first wave of 116 cases, stigma and discrimination is going to be a real issue. We have brought Dr. Hazel Othello on this platform at least twice or three times to speak to that same issue. And I will hand over to Dr. Richards to talk on the technical aspect. Before a person is discharged or allowed to go home from any of our facilities, whether it's a treatment facility, a quarantine facility, or a step-down facility, they must receive 2 negative tests. That will give the person and their family a high degree of confidence that they are free from the virus and that they can go home. The other aspect of it, which I touched on originally, and that is why I never and will never speak on air or in private, even though I am encouraged to do so by questions coming from the media about individuals. That is why, from prince to pauper, they are entitled to be anonymous as far as the public discussion is concerned. They are entitled to their privacy. I saw one letter to the editor maybe about a month ago when the issue of a personality, and that letter writer put it in the context that he has a right to know. His right to know supersedes the patient's right to privacy. That can never be. It can never be that the public's right to know about an individual's medical status is superseded by the public right to know. Never. So that is my position. If you want, we can bring back Dr. Hazel Othello to talk about stigma, discrimination, but I will turn over to my colleague who can go into some more technical details.
Thank you, Vern, for highlighting the issue of mental health for COVID-19 patients and their families, because, of course, the issue of stigma and discrimination does not just apply to the individual who was tested COVID positive and who has received treatment, but to those that they come in contact with, their co-workers at the workplace, and, for example, the persons who they are in contact with at home. Now, as per stigma and discrimination, the Ministry of Health has a counseling session and counseling hotline set up by the persons at the quarantine centers. And we have our Director of Mental Health, who has really worked extensively in terms of curbing the issue of stigma and discrimination with her mechanisms and her way moving forward. So that's an issue that we are actively looking into, and we have sessions and persons in place that are there to counsel and to provide feedback for persons with discrimination.
Thank you. Thank you very much. Well, we are out of time. We've come to the end of today's virtual media conference. Do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. The government has eased some of the COVID-19 restrictions as Trinidad and Tobago slowly reopens. Today, a number of our students will return to our shores from one of UWI's campuses, and they are just one of a group of thousands who will be part of the managed return of citizens to this country. All of them will be placed in state quarantine upon arrival. But we wanted to remind you that now, more than ever, we need to remain vigilant. Now is not the time to become careless and return to the way we did things before COVID-19. We have done very well up until now, but remember, the reason for our success is our well-thought-out public health strategy. And that strategy worked because many of us listened and implemented the recommendations and guidelines of our public health officials. Let us continue to do so. Let us not forget to wear our masks, wash our hands, adhere to proper hygiene, and maintain physical distancing. These are part of our arsenal in our fight against this odorless, invisible virus. We need you to keep Trinidad and Tobago healthy and safe. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flattened and beat COVID-19. Stay safe. May God bless Trinidad and Tobago.